Thank you very much. Dear colleagues, I'm happy to welcome you at the second year of implementation of the regional project, Sustainability of Services for Key Populations in Eastern Europe and Central Asia. This meeting unites the partners from 14 countries that have been working in probably one of the most difficult years for public health projects. My name is Tatiana Deshka. I will be the moderator of today's meeting. I will start with a few technical or logistical issues. We are going to use two working languages, Russian and English, with simultaneous translation, so please do choose your channel. Second, the meeting includes two parts. The main part is about 2 hours. It will be in the Zoom broadcast to YouTube and Facebook, and after that, the broadcasting to YouTube and Facebook ends, and we will start discussing intra-project activities in the Zoom without broadcasting, without the stream, and it will take about half an hour more. So I suggest that you ask questions in the chat, in Facebook, in YouTube, in Zoom. We will collect those questions, respond to them as they appear, and answer those in the end of the session. I'd like to draw your attention to the fact that this session will be recorded. So let us start. I, first of all, would like to give the floor for the welcome words to Andrei Klepikov, Executive Director of Alliance for Public Health. Andrei, please. Thank you very much, and good morning, dear colleagues, dear friends. It is an important time and an important meeting. This year has been the most difficult in decades. COVID-19 it has impacted our lives so much in all areas that we have to actually sum it all up and decide what has let us stand fast and even move forward. I'm happy that our project for sustainability of services for key populations has proven to be really sustainable, and it has proven the sustainability of all the progress that we have all achieved together. In this difficult time, we have been able not just to stand fast, but also to implement certain innovations, some things that will let us continue the work in the next year as well. So let me remind you that in some Latin American countries, all the transition was actually terminated. In our region, we were able to keep it up. So the project has proven to be sustainable not just under normal condition, but also in the situation of crisis in which we found ourselves, all the world. And it's an important time not just to make some interim review, but also for the planning for the next year, for the following periods. So I'd like to say a lot of thanks to the partners, to the donors, the Global Fund, and the Network of People Living with HIV 100% Life, our core partner under this project. And also I appreciate the efforts of all the partners in the countries and in the inter-country work. So let us be as effective as possible during this meeting and have a really good and fruitful day. Thank you very much, Andrei. Now I'd like to give the floor to Dumitru Letichevsky, who is responsible for the portfolio of the ECA region in the Global Fund to fight AIDS, tuberculosis and malaria. Dumitru, please. Yes, good morning, dear colleagues, and I want to say, yes, good morning, friends. Really, Andrei was totally right, saying that this is an important time for an important meeting, and that's also some very important activity for us. And the proof of the importance of this activity is that the Global Fund has decided to provide funding for the next 3 years of similar activities. The fact that prevention has been so sustainable and so resistant to the epidemic is a very important and interesting point. And we'll try to learn some lessons from it for all the HIV and tuberculosis response activities. Unlike detection of tuberculosis and AIDS, the rates that have dropped to 40 or 55, 60% in some countries, the prevention activities have not suffered much, or if anything at all. So they didn't show any losses, and that's a sign that we need to learn something from it, to apply those lessons for detection and treatment as well. And this drop that we have seen this year is in itself a problem, but it also means that for the next year the objectives will be much higher, because we will have not just to detect those cases that have gone undetected this year, but also we will have to detect the cases that have been able to spread out further this year. I'm talking both about tuberculosis and HIV. So next year our tasks will be much harder than in any other ordinary year of implementation of HIV tuberculosis response programs. Nevertheless, let's be optimists. We can make it. It will be important to say the best of goodbye to this unusual year and learn the necessary lessons. So have a good and fruitful meeting. Thank you. Okay, so it has shown us that we can not just see the challenges, but also respond to them very well. So, okay, so dear colleagues, yes, I'm glad to welcome you at this meeting, because now we are at the planning stage, and it's important and interesting to decide about the future of the projects. Why? Because 2 years ago we wrote those about these projects, and now we get the fruits of it. We would not have been able to overcome this difficult year if we didn't have a strong civil society sector. It's a driver of all the changes and progress in the countries that influences the policies of the donors, the regional policies. So let's just imagine if we didn't have the networks, the organizations, the community-based organizations, then 2020 would be a disaster. No country in our region has shown some personalized individual policy with regard to communities. Usually the drivers of those policies were the community-based organizations, and people living with HIV in their communities, they forced the government to take measures. And so the civil society sector has become the sort of locomotive to move forward the changes that have been achieved in the region. And currently all the non-government organizations, all the community-based organizations in this difficult situation has proven to be indispensable. I think that's a showcase for all the donor system, not just the Global Fund. In the situation of crisis, you will always have a partner with endless motivation. Even if we don't have resources, we will move on because that's all about our life and the lives of the people we represent. And I think that the design of the new project and the vision of the new project needs to take into account this particular important factor if we want the sustainability and persistence in change. We need to have a strong civil society sector. So investments in civil society in these 10 years have shown their importance, and they have proven that, I'm talking about Ukraine now, everything has happened only because we have the organizations that never stop. All the changes in Ukraine have taken place not because we had great politicians who wanted changes. They happened only because we had organizations that forced those politicians 24/7 to do some change. And the planning of the next grant needs to take that into account. And I think that's an important discovery, not a theoretical thing that we always have understood, but in the real life situation when we have all those epidemics and the pandemic of COVID and difficult situation in the healthcare, we were able to change rapidly, come up with innovations, change the structures, and achieve the best from our changes. So I don't think that 2021 will be worse. It will be a bad joke, but even if it is worse, we will be better. Thank you. Thank you very much, Dima, for these inspirational words. Yeah, like you equaled sustainability with persistence of our colleagues from the civil society. Now let us discuss how the project worked this year, what interventions have allowed strengthening the programs of HIV response for key populations. I'd like to give the floor for a small presentation to director of the project, Sergei Filipovich, who will tell us about the key highlights, key achievements that the project has been able to produce in 2020. Sergei, the floor is yours.
Thank you. Thank you. So, we have this meeting trying to summarize the second year of the project in quite an unusual situation, but nevertheless, this is the biggest comprehensive project in the EECA region, which already has been running for 2 years. It's really comprehensive in terms of its composition, in terms of the countries it covers, and the objectives of the project. Besides the national cover and the countries which take part in it, there are also cities taking part in the project. And 25 cities, there are over 200,000 people with HIV living. So the focus is both at the national level and at the city level. This project also is unique because the partnership between the countries in the EECA region and SEA has never been implemented like that before with the support of the Global Fund. And the Russian Federation and the cities also take part in this project, and we will mention about this later. The project has certain indicators, the indicators we use in our work, the outcome indicators. You can see them on the screen now, and let us have a closer look. The economy indicator, when we were procuring the ARVs, significant progress is achieved through regimen optimization and the improvements in the procurement mechanism. the increase of the national funding for the prevention for key populations. It's also one of the indicators. Strengthening the cascades in the cities of the projects and the number of people who are aware about their status, the number of people on ART, well, it should be as close to the 90-90-90 target as possible. So the percentage of people on therapy also is approaching 90% in the cities which take part in the project. So what are the major achievements throughout this year? In the beginning of this year, we've been trying to summarize the previous year, and we were thinking, how would the 2020 turn out? Of course, we didn't see the whole picture, and we couldn't envision that it's going to be difficult, even though the pandemic was starting in the end of February. Still, we couldn't see the full scope. Anyway, we have agreed that the budget advocacy will be going on with the partners on the second regional project on TB. And even though the conditions were difficult, we have implemented that idea. We have planned some on-site visits, but we've transferred all that to the webinars, and we have organized a series of webinars for the civil society and the partners on budget advocacy in the spheres of HIV and TB. In the Russian Federation and in Moldova, there were awareness campaigns aimed at motivating people to get therapy. Also, as the pandemic has started, we have analyzed the best practices in the region in responding to the pandemics, and the experience aimed at the experience of countering HIV in the context of COVID-19 has been aggregated, and we've sent out the recommendations to all the partners so that the national programs could be adapted to the new reality, and so that they would keep the clients accessing the services. Also, we have achieved the first regional funding for COVID events. This was additional funding as part of the Global Fund regional grant. Throughout the year, we have successfully implemented the REACT program in 4 countries. Over 2,000 cases have been documented. Over 50 non-governmental organizations took part in this process. They have collected the information, they have responded to the rights violations. An operational study. It had some difficulties and delays due to the changes in the situation, but they have been running and they are completed, and the reports are due next year. This is the PrEP operational study, an operational study on transgender, on OCF cities in Belarus, Moldova, Macedonia, Georgia, Russian Federation, and Uzbekistan and Kyrgyzstan. Despite the difficulties, we have changed the modus jointly with our partners, with UNAIDS, and we continued the process of signing the Paris declarations in Serbia, Bosnia and Herzegovina, in Uzbekistan. Even though the times were difficult, they have signed the Paris declarations. The cities have aligned to HIV/AIDS control, and they have been allocating funds to respond to the epidemics. The cascade has also improved in the fast-track cities. Even though the situation has been difficult, they have kept the services, and in some situations they managed even to improve the services. If we compare to last year, the cascade figures have improved. Another important trend was the ART optimization in order to reduce the cost of drugs and in order to achieve economy. Here, I would like to note some important information. The producers have agreed to license dolutegravir for the countries of our projects, the Belarus and Kazakhstan. Also, in the Balkans, they have started important dialogue. They have started an important process on ARV cost reduction. Thank you so much, Sergey, for this review. Next, during the course of the meeting, we will look in details what has led to the achievements that has been outlined by Sergey. We will see which actions in the countries and the cities have led to the sustainability of the services. Next, we proceed with the second block of the program on ARV cost reduction. Why has it been such an important theme for the project? Usually, when we talk about sustainability, the discussion goes, where can we get the money to pay for the services, for the key populations? For our countries, there's an obvious answer. The procurement cost of ARVs in our region is one of the highest globally. So unfortunately, when globally they can buy drugs for $100 per patient per year, in our region the price went up to 1,000. So if we manage to optimize that and redistribute that, a comment, I can't hear anything. The speaker continues. So we could cover everything with the services. We could cover the key populations in the region. So now I would like to give the floor to Sergey Dmitriev from the 100% Life Network, and he will present the achievements of this year on ARV scale-up. So, hello again. I would like to add to what Tatiana has said. Indeed, the objective of the project was the regimen optimization and the sustainability of services. Indeed, the economy which can be achieved should be distributed to services sustainability, following the Ukrainian model. When the funds saved with optimization were then dedicated to the prevention services and support services. So it's important that globally there would be mechanisms of redistributing the funds to the services. And this is one of the key links. And the budget advocacy specialists in the countries, they're doing exactly that. They help streamline the processes, which would help redistribute the funds from one program to the other. And briefly about the achievements we have had. I could only say that at the moment we cannot give you the specific figure of savings in 2020. We'll be able to do that in January because the budget year is still going on, so we don't have the final figures until the mid-January. But I would like to share some information which already is available so far. Well, you know that last year has been quite successful. We've saved 27 million in the region on drug procurement. with the efforts of all the partners, the country partners, the experts, and the result shows that this is the way to go. And this year will also be effective. I would like to know that currently, let's say, at mid-project, the project is for 3 years, and at 1.5 years, we have managed to achieve the cost of TDF, XTC, and the FAVRENS has not exceeded $131. So we really have achieved this indicator, and this is an achievement for the project. I would like to note a fantastic case we've seen this year in Moldova. We have the specific figure of savings. So it's almost $600,000, which is really a lot for the country of Moldova. And we would like to note the following, that in all these savings, in all these figures which we are presenting, well, this has been the effort of the community, of the NGOs, and they use now better mechanism. They started joining the planning process in the country. They have the technical capacity to analyze the tenders and to stop some tenders. And in Moldova, at the request of Moldovan partners, they have announced a re-tender. Indeed, the procurement agency saw what can be improved. There was also some cooperation with the producers so that they could join the tender directly, and also the terms of reference for the tender has been changed, and that really helped achieve such saving, which is significant for Moldova. Another big achievement has been taking place in Kyrgyzstan. I'm sure that the partners further would dive more into the topic, and they will tell about the tools they have used to achieve this. So they have purchased TLD for 86 per patient per annual course, and it is really $100 cheaper than last year. So this is really good economy. So we have successful cases in the region this year, and at the end of January we'll see that the total economy for the region is quite significant. I would like to note once again, what's important is that the patient organization, the NGOs, are using a series of tools which help achieve these savings, and they help expand access to treatment. Because saving is one thing, but we don't save money for the country in general. We want to scale up the treatment, because in some countries of the region they really don't have the funds to scale up the treatment. So these money that have been saved, they are not allocated to other programs. They are either used for the scale up or for the prevention and support. Also, the main milestones in 2020, well, you remember there was a series of mechanisms for scale-up announced, and the implementation of the latest WHO recommendations. So there are countries which use non-WHO recommendations, and there usually, well, the treatment process does not have clinical and economic grounds behind it. We see in some of the Balkan countries, and I'm sure the colleagues would expand more on that, and the two countries, the Kazakhstan and Kyrgyzstan, they have adopted new guidelines which are quite innovative. So, for example, besides dolutegravir, they have started the new innovative integrase inhibitor as a first-line treatment, and they have their license. And so in the first line there would be a competition of two innovative drugs. So it's dolutegravir and dexagravir. The price would be more or less the same as far as I understand, and we will see the competition on the tenders, and that would help us drive down the costs and avoid the monopolies.
In Kyrgyzstan, the protocol also reflects WHO recommendations clearly, and it will help spreading the coverage of treatment and save them money. In partnership with ITPC-RU, we conducted analysis of compliance of the national treatment guidelines in 9 ICA countries and 5 Balkan countries, and at the beginning of the project, when we presented this activity, our colleagues from several donor groups, including WHO, said that it was not very clear for them that what was the point of this activity, because the WHO asks countries about such things, asking their governments, but actually, we answered that this is a patient-based control that's oversight by experts. The most tenacious people, and so we have provided a very big report on 135 pages, and after presentation of this report, we had meetings with all the experts who produced it and the representatives of the WHO and formed the strategy. The strategy on how they will change the approaches to follow the WHO recommendations actually. So this really helped the European office of the WHO. Also in the partnership with ITPC-RU, we conduct regional ICAT meetings. That's a platform where patients, NGOs, and pharmaceutical companies, both regional and generic pharmaceutical companies, they meet the representatives of the authorities. They discuss possible price cuts, simplification of market authorization. So this way they create more competition on the market and reduce the prices. Also, the ICAT meetings this year were joined by people from UNICEF, the regional UNDP office, MPP, and the WHO, and the results will be presented in the rest of the year. It will be seen in particular numbers early next year. For some reasons, the screen doesn't work. Oh, yes, it does. Okay, so what key challenges do we foresee for 2021 in addition to the plans that we are designing now? Some of the good planned actions are jointly together with the Central Asian Network and the regional WHO office. We will conduct a number of webinars. The target audience will be clinicians and patient organizations of ICA countries. So this will be the continuation of what we do now in the context of clinical recommendations, which will also bring in some savings. So we want to establish synergetic interaction of clinicists, patients, and WHO specialists. Second is continued work to expand access to generic DTG for several countries. You know already about the voluntary license, and Liva will elaborate on that a little bit later. But actually there will be a lot of technical points, a lot of technical tasks for expanding the use of dolutegravir in this country. So they will have to change the policies and help with the market authorization process, which has to be simplified. We will do that as well. And we also work actively to provide access to DTG in the Balkan Southeastern Europe countries. As you know, that those countries didn't have the objectives regarding the access to treatment under this grant, but at the beginning of the project, the Global Fund and representatives of the country decided that this activity is needed, and we analyzed the situation in 5 CE countries and developed a plan to improve the coverage and access to treatment, reduction of the prices. We conducted a beautiful activity a week ago where our partners AIDA helped us to get together clinicians and the patient community from the Balkan countries and create their mutual understanding, hear their needs and desires with regard to optimization of the treatment and establishing competitive atmosphere on the market of ARV drugs. And now we are looking forward to receiving the work plans from the country. We will join their activity, we will work as experts and implement the plans that we have proposed to the countries, and those plans that we are looking forward to getting back with some corrections and adjustments from the countries, and also improvement of HIV treatment in guidelines in Belarus. We'll be talking about that next year, but that's the result that we expect truly this time. Now, thank you very much for your attention. I'd like to maybe emphasize the main goal of the project and the main results that we see in this situation are that the civil society sector does have the tools, uses these tools, the tools that help us to reduce access to treatment, that help improving communications with the government, with experts, so they're communicating equally. And there is no conflict in that. So all of it is an absolute synergy, and that's a great achievement that really fills me with joy. And the mechanisms that are being developed for money reallocation to let the sustainability prevention sustainability services operate in the region. Our partner Maxim Demchenko will tell you more about that. But that's a great achievement too. So thank you very much for your attention, and we will provide you some more numbers in the end of January to show the real results of 2020. Thank you very much. Thanks a lot, Sergey. And those are real results that we're able to achieve in the 2 years of the project. So thank you very much for the presentation. A few technical points. You remember the simultaneous interpretation is available in the bottom part of the screen. You see the icon of globe. Please press it to select your language. If you understand both languages, you can listen to the discussion as it goes. But I'd like to know that the slideshow now works. Please do not share your screen. We will do that. Sergei Dmitriev mentioned the work to improve the access to ART in Southeastern European countries. That's really the activity that was created based on the analysis of the needs and the costs of procurement of ARV drugs in such countries. The project countries now pay 10 times more for drugs than they could if they worked through market price. So, under the project, a lot of analysis was done in order to improve this accessibility. Now, I'd like to link to our discussion Aida Kurtovic, who represents the network of HIV and tuberculosis communities in Southeast Europe.
Hi everyone. So I'm Aida, and today I want to speak with you about the Southeastern Europe Regional TB and HIV Community Network. This network was established a year ago in response to unmet needs of communities, being people living with HIV and people living with tuberculosis in southeastern Europe. We have established this network because we strongly believe that communities should be in the center of the response to HIV and response to tuberculosis in our countries. Unfortunately, that is not the case. To solve this problem, to address this challenge, we have initiated two initiatives. One initiative is Regional Needs Assessment, which is being conducted in 11 countries of our region, and where we want to identify and document challenges faced by the communities, by people living with HIV and tuberculosis. Once we have documented challenges, we want to take further actions to address those challenges and improve the quality of life of communities in our region. The second initiative is related to the right to have access to the quality treatment for the HIV. Therefore, with support of the Global Fund to fight AIDS, tuberculosis and malaria, with support of the Alliance for Public Health from Ukraine, and with support of our technical partner, 100% Life, we have initiated regional discussion in 5 countries of the southeastern Europe, being Bosnia and Herzegovina, Montenegro, Serbia, North Macedonia, and Romania, about the access to treatment and prices of the antiretroviral drugs. We have also managed to include 2 countries which are not part of the SOS project, Kosovo and Albania, in status of observer in this initiative. Due to the COVID pandemics, we were not able to move as planned, but we have been able to transfer our activities online, and we did have an online meeting just a couple of days ago, where we are very happy to see that 54 people, decision makers, health authorities, clinicians, affected communities, and civil society have joined us and supported this initiative. Right now, we are at the stage where the countries, each of the 5 countries, is discussing its own action plan, but we are hoping that within a year, we will see the result of this initiative. And that should be removal of disparities and assurance and provision of the equal access to the quality treatment for the HIV and AIDS in our region. We are hoping to see antiretroviral drugs being procured at cheaper prices, and funds that are saved from the procurement of the antiretroviral drugs again can be reinvested into the HIV response. Unfortunately, so many countries of our small sub-region are still facing challenges to sustain the gains of the programs that were supported by the Global Fund to fight AIDS, tuberculosis and malaria. We do not want our countries only to sustain gains. We want countries to be able to responsibly respond to the HIV and tuberculosis while keeping communities in center of this response. So we hope that this initiative will not only, if I may say only, contribute to the improved access to the treatment, but also that this initiative will enable funds to be invested in HIV response into the HIV prevention programs that will support key affected populations and prevent further spread of the virus within the populations. Thank you very much. Looking forward to talk to you in greater detail. Bye-bye.
Well, we have been hearing from the representative of the Southeastern Europe about the progress of the project on antiretroviral drugs in this region. Now we're going to hear an interesting presentation from the Medicine Patent Pool, MPP, on how they were able to work on the access to the drugs in the countries like Azerbaijan, Belarus, Kazakhstan. Just a few years ago, a few weeks ago, MPP announced a very important initiative, the reduction of the cost of dolutegravir and TLD for these countries. Let us hear about that. Good day to you, dear colleagues. My name is Ludmila Maestat. I work for the Medicine Patent Pool, MPP. I'm a policies and advocacy manager. I have good news for you. 2 weeks ago, in the end of November, we signed the license agreement in order to improve the access to quality assured and pre-qualified by WHO DLT and TLD for several countries of Central Asia as well as Malaysia. Before I tell you about the importance of this agreement, I'd like to tell you briefly about the license that MPP has for DTG and about the importance it played in the access of the countries to the above medications. In April 2014, MPP and VIV Healthcare signed a license agreement in order to improve the access to DTG and TLD combination in 73 countries. In 2016, all the other countries of middle and lower middle income were included in the license, and Armenia, Moldova, Morocco, and Ukraine were able to procure this particular drugs. In 2018, Mongolia and Tunisia were added to the license because they became lower middle income countries. In October 2020, for the same reason, Algeria was added to the main license agreement. Currently, the license covers more than 100 countries that have access to pre-qualified DTG, TLD that was pre-qualified by United States FDA, produced by the partners of the MPP. This map shows that DTG and TLD are procured in 81 countries and in 45 countries TLD combination has been approved, and in 21 countries they filed in for the registration. One more example, this table shows the size of procurements, DTG and TLD in southeastern Eastern Europe and Central Asia in the last years. You see Ukraine has the leading role in terms of procurement, but in other countries the size of procurement also has been growing, which proves that the countries have started switching to TLD and DTG according to the recommendations of the WHO. The speed of this shift depends on the size of procurement. The more is procured, the more patients will have the access to the necessary treatment. The size of the procurement depends on the price, and that also means that access of generic drugs to generic drugs is very important. The countries with upper middle income are difficult to include in the agreement because the countries the producers believe that they need to pay full price. Now we have this mechanism to improve the access to the middle income and lower middle income countries to generic products that cost less. Now this story with improving the access to the countries with upper middle income. Well, this story started in 2016 with a request from Malaysia. Now in 2017, Belarus was the first country to request the inclusion in the MPP license. We received the requests from the government and the NGOs. The same we received from Belarus and Kazakhstan, and in 2019 from Azerbaijan. For 2 years, the MPP, together with NGOs and CSOs, held a lot of discussions involving other stakeholders, Global Fund, and so on, as well as partnership under SOS project. This has been a long and difficult process. In 2019, official negotiations started between MPP and the VIV, and in the end of 2019, we signed an agreement to provide access to 4 countries to quality assured DTG and TLD. The new license agreement includes Azerbaijan, Belarus, Kazakhstan, and Malaysia. The countries get the access not just to WHO pre-qualified DTG, but also to the TLD combination. Both drugs are produced by the partners of MPP. We also can buy now DTG pediatric. The good news is that 2 partner countries have already submitted the request for registration of DTG in the form of 10 milligram dispersible tablets. Of course, the price will be reduced, but not so much as to the low middle income countries. We conducted negotiations with the countries to understand what price will be accessible for them to start shifting to the DTG. And once the country becomes an LMC, they will start holding the procurement, and we expect that the cost will be reduced by up to 50 to 70% of the term price for originator's product. It also depends on the size of procurement. So the more you procure it, the lower the price. So if the country becomes a lower income country because of the crisis, it will automatically join the main license agreement between MPP and VIV, and the cost of the GTG will be the same as for other LMIC countries. And the final point, signing the license is not the happy end, not the end of the story, but another step of our important cooperation aiming to achieve access to high quality DTG and TLD to those who need that. What are the next steps? MPPs have started selecting the generic partners to provide DTG and TLD pre-qualified by WHO and approved by FDA. The duration of registration will depend on countries. All the 4 countries are part of the WHO collaborative procedure for accelerated registration, according to which the registration should take not more than 90 days. It is important for the countries to remember about this and use this opportunity.
And I would just reiterate that the final price would depend on the volume of the drug procured. And the most important, that this license agreement became reality only through your efforts. The CSOs, the NGOs, all the partners who played a very important role. And of course, the project helped a lot, working with the national government and global authorities at different levels. So thank you all for the cooperation. Ludmila, dear colleagues, I would like to remind that you can ask questions in the chat. We will respond throughout our meeting. We will assemble them into a set of questions and we will respond at the end. So let us move on. Sergei Filipovich has already mentioned that working in cities is an important priority for us. The number of cities who have signed the Paris Declaration has increased by 10 this year. During the pandemics, we saw that the cities essentially became different countries because they had different measures introduced. And we see that, of course, the measures which the cities are taking affect the health of the citizens directly. Now Sergei Filipovich will present the progress on fast-track cities. Dear colleagues, we would like now to present an important direction of our work. I have mentioned it in the beginning, and this is working with cities to strengthen the municipal response to the pandemic. The fast-track cities. The initiative has been proclaimed on December the 1st, 2014, and as of today, over 300 cities have joined the fast-track municipal response. In the ECA region, there are 25 cities from 13 countries. And as of today, from the SOLS project, the 17 municipalities have signed the Paris Declaration, and only in 2020 9 cities out of these 17 have joined the fast track cities. In every city which has joined this, they have an HIV work group, including the key population representatives. They have citywide programs, and they allocate funds to achieve the 1990 objectives. So, what are the achievements in this sphere? For the first time, the municipalities of Chisinau, Minsk, and Osh have adopted the city programs, which were developed as part of the SOS project. The Soligorsk, Svetlogorsk, and Dushanbe are now finalizing the budgets of these programs, and we hope that by the end of the year the budgets would be approved. In some cities of the Russian Federation and Uzbekistan, which take part in the SOS project, they also have similar programs. So this indicator on having the programs and funding allocated for them would be achieved this year. Advocacy work has resulted in additional measures during the COVID pandemic in the city of Osh. They have allocated funds for 600 food packages for people HIV in difficult situations. They were funded and delivered. Also the drugs for the migrants which have been working in the Russian Federation, for the migrants from Osh. They have been distributed through partner organizations. The Chisinau, for the first time, they have allocated the municipal plan for 2020. And as part of this plan, in 2020, they have allocated 500,000 lei for the HIV program. And they have procured services from the NGOs, the services on prevention, and now they are working on the program 2021 to 2025. In Russia, Chelyabinsk, they have created 3 easy access sites in Magnitogorsk, Kepeysk, and Prolesk, and they have expanded the geography and they test social support. Also, they have built the green corridors to have barrier-free access and support for people with the positive test, to support IRT initiation. And also in Sverdlovsk region, they have analyzed the barriers and they work to remove the barriers in access to treatment. The work is going on jointly with the AIDS Center, and this cascade indicator is improving, which we have mentioned already in the beginning. The awareness campaign already was mentioned. I would like to reiterate again, because firstly we started it in Russia and in Moldova at the municipality level, and this has been quite a creative program. Hashtag in your power, and it has been scaled up to the national level through the Positive Conductors project. In Belarus, Svetlogorsk, the People Plus organizations, jointly with the penitentiary department, they have created their work group on socialization of people who came out of prisons, and they have organized partnership relations to provide support and aid to these people. Also, the People Plus have organized the online counseling for the prisoners in Svetlogorsk. Soligorsk. Besides allocating the funds, the municipality has supported the NGOs by providing the premises to NGOs to work with MSMs and sex workers. These rooms. They work with the support of Soligorsk Executive Committee. In Bosnia and Herzegovina and in Russia, as part of the additional COVID component, they have started some response measures, but we will mention them later in the COVID section. Those were city-level initiatives to respond to the pandemics, to ensure program sustainability. The improvement of the cascade, you have seen it briefly in the beginning. Now let us dive into the details. We see the improvement of the cascade, and if we look at the objectives, it's better on testing in people who are aware of their status, but still it's not high enough on the percentage of people on ART out of those who are aware of their status. Even though I said that in 2020 the figure of this indicator has improved significantly compared to 2019. And budget advocacy. This indicator also, first of all, is relevant for the city-level initiatives, and these advocacy efforts is representing exactly that, the share of municipal funding. On Osh and Chisinau, well, the figures are not as high as in some Russian regions, but still, in the Russian Federation, through the advocacy efforts of the NGOs, the municipalities have allocated funds for the prevention programs, and that is both the funds from the presidential grants and subsidies and local monies and the donations from businesses, and the increase is quite significant when compared to the baseline. Thank you so much. Thank you, Sergei. The city of Chisinau, as part of the SOS project, they were the first to sign the Paris Declaration last year. Now we will see what did they manage to achieve in the meantime with the support of our partner, Positive Initiative. The world where life is the ultimate value. 2020 was a historic moment for the Chisinau municipality. For the first time, the authorities have allocated $500,000 lei for the HIV response. It was a transparent process. The NGOs, the experts, and the authorities have been involved in the meetings where we developed the municipal plan with specific indicators for the performance. It all was possible with the support of many partners, but it started with the signing of the Paris Declaration. So, a bit of history. The Paris Declaration, or the initiative to speed up the municipal response, is the global partnership between the municipalities and some international organizations, including UNAIDS, or the United Nations HIV/AIDS program, and the city of Paris. The Paris Declaration is important because it requires the mayor's offices to take certain measures, as the cities have been affected by the HIV pandemics the most. So the response measures are taken where the need is the highest. There are target programs with certain priorities and funds allocated, which means that essentially the city level is closer to the residents and their health needs. On May 31st, 2019, the acting Mayor General of Chisinau, Ruslan Koldanu, and Vinay Sadana, the Director Regional on UNAIDS in the ESA region. They have signed the declaration to increase the response at the municipality level. In December 2019, the mayor of Chisinau, Ion Chiban, with representatives of 50 municipalities from all over the world, took part in the Kyiv Forum, the response to HIV and TB, where the mayor has announced the plans of the city to control HIV and TB, and they reaffirmed the undertaking to strengthen the response. For the first time, the group was created at the municipality level, at the mayor's office level. The group includes the representatives of the authorities and the civil society organization. The work group has prepared a very important document, which essentially is the municipal action plan to prevent and control the HIV/AIDS and the STIs in 2020. This plan is now being implemented. In Chisinau, just like in other countries in the world, the communities of people who live with HIV and the key populations play a very important role in development of the response plans. So the specialists of the municipalities, of the NGOs and international organizations have jointly created the program aimed to reduce the transmission rate and to improve the support for the people who live with HIV. And so the municipal program was adopted. Despite all the efforts adopted by the municipality, the epidemic still progresses. So we have to respond better, faster and more effectively. We need coordinated actions on all the levels. And this all, of course, has to be supported by the resources. When we consider the situation of the lack of resources for the national program, the municipal programs become more and more important. They need to cover this deficit. So I'm proud that I took part in the signing of the municipal program with specific targets, objectives, performance indicators, and supported by funds. U equals U. A great example of how even during the COVID pandemics, the cities can be mobilized and the resources can be mobilized to fight the HIV. Now we continue the topic of the cities, and we will hear another report from the southern capital of Kyrgyzstan, the city of Osh.
Ну что ж, подходит к концу 2020.
Well, this is the end of 2020. A difficult year, and jointly with our partners, we managed to achieve quite a lot because we believe that we can achieve what we have planned. The most significant achievement probably is that jointly with the mayor, with our partners, and with the AIDS Center, we have signed the city action plan, where we outlined the significant steps that would be undertaken in the next years. In this difficult year, our partners, jointly with the state authorities, have conducted a lot of work, so let them present what they have done. Dear participants of the International Partners Meeting, dear guests, the mayor of the city of Osh has signed the agreement to join the city of Osh to the Paris Declaration. I would like to know that the signing of the declaration is one of the most important tools to control the HIV and AIDS in the city of Osh. In this way, the mayor's office of Osh undertakes the obligation to achieve a significant target to reduce the spread of these infectious diseases. So the mayor's office of Osh, jointly with the Ministry of Health of the Kyrgyzstan Republic, will do their best in order to improve the access to treatment and prevention for HIV and TB in the next years. The work group, which was organized in the city, has met and discussed which measures have to be taken at the city level in order to fight the infections in 2020 to 2022. So, we have approved the city plan in November 2019, and the action plan also was adjusted to the pandemic needs, and as part of the social contracting, we have also provided financial assistance to cover the needs of children with HIV and people in difficult situations. We activize the efforts to reconcile the registration lists of people with HIV, and with joint efforts we will be able to achieve the target indicators according to the city action plan in 2021. Thank you for your attention.
In 2019, on the 21st of August, the municipality of Osh has joined the Paris Declaration, calling for complete eradication of HIV and AIDS by 2020. Because of this, we established a working group which had a few meetings. And based on the documents that were created by this working group, we finally, on the 24th of November 2020, were able to approve this action plan. That is, the authorities of Osh have adopted this plan. Despite the problem with COVID-19, we created a mobile visit team that made actually those home visits, delivering the ARV drugs, and we did everything we could to help people to get tested for viral load and CD4. Also, to support our people with HIV, we delivered food packages. That's also a bit of motivation to make people living with HIV receive that psychological support in this very difficult time. I can say with confidence that we have budget backing for this plan, because many lines in this plan are, well, there are promises from international organizations and from the municipality that they will be supported. I've been working for the second year, and I see a very well-established dialogue between our authorities, international organizations, local NGOs. We see that the efforts are consolidated. When we had working meetings, we did the common thing. In 2 years, we have achieved a lot of experience and signed the Paris Declaration that has also been signed by 300 cities in the world. We've adopted the HIV response plan for the city from 2020 to 2023. The year 2020 has been a difficult one. In these conditions, we continued working. We kept sending ARV drugs to our patients in other countries as well. We provided them with food packages during the lockdown time and provided home-based services to our clients. And we believe and we know that we must not lag behind, we must move forward. We understand and we know that the funding under this SOS project will continue. Yes, so you have heard about the main steps. All the political decisions have been made and we now only have to do the practical thing. We need to expand that coverage with tests. So we need to let every person who needs services on HIV and AIDS to be able to receive such services. And we are sure that the goal that we have set to eliminate the epidemic by 2030 is really achievable. Great reports from the cities have allowed us to feel closer to the things that have been happening in the project in these years. And now to the next important topic of our project, budget advocacy, because allocating the funds for HIV programs doesn't mean that they will actually the money will actually be used for the needs of key populations. What did the project do to provide the key populations and their programs with the resources? Sergei Filipovich will tell us more. Budget advocacy is also an important task under this project. And of course, it is clear that you will get no services without money. Yet, it must be noted that we have not just this figure of the allocated budget, the sum of the national budget and cities' budgets for key populations. We work together with our partners on developing tools to let us provide the services using these tools. And that includes unit costing and functional mechanisms and the budgeting of national and regional or city programs, capacity building. Together with our key partners, 100% Life and the Institute of Analytics and Advocacy, depending on the needs of the countries, on the level of their preparedness and the maturity of the process of national and city response budgets, we provide services, technical aid, helping cities and the countries. The next slide, please. And here, a few examples of how in different countries, at different stages of the budget advocacy process, they conduct the work. According to the standards in North Macedonia, Moldova and Tajikistan, they have developed those country-specific standards for HIV service provision. We do some work on costing as well in 2020. Yes, we used to provide this support to other countries before. In Moldova and Tajikistan, we conducted trainings, and in the Russian Federation, our partners who contribute to the development of national strategy for combating HIV also helped us with unit costing. Well, we did provide help with calculating the tariffs for the services, and the organizations also submitted their proposals to law on social contracting to ensure funding of services for key populations at budget costing. And of course, without changing the legislation, the whole mechanism will not work properly. And in 2020, in Georgia and Montenegro, our partners have conducted advocacy for changes in legislation, making social contracting possible. In Georgia, they've already started piloting the system of national funding. And recently they've had a discussion of various approaches to this piloting. And we hope to see some very good results of this approach. Without mobilization of the communities and building NGO capacity, sustainable funding is also not fully operatable. So that is why working with the countries and our partners, as I've mentioned, has been conducted. We've done a lot of workshops and webinars to provide them with a deeper understanding of these tools and mechanisms. Yes, costing and budgeting is important, but it's important also that we provide them with tools to ensure sustainability of the funding and actual allocation of the money. Thank you very much, Serhiy. Our partner on budget advocacy, Institute for Analytics and Advocacy, has been working actively in these countries, and I'd like to give the floor to Maxim Demchenko to tell us about what has been done in 2020 and what is to be expected from the nearest future. Hello, dear colleagues. I'm happy to welcome you at this meeting. Thank you for the opportunity to present the results of work of our team for 2020. The year that was quite difficult for all of us, but it was important because we were able to actually evaluate all the investments that had been made before in ensuring sustainability of HIV/TB services. Our healthcare systems were greatly overloaded and encountered deficit of budget. And as our colleagues mentioned before, we have this effect because our programs stood fast. No country of the project stopped the transition project, and that means that we are moving in the right direction, and the approaches we use in the advocacy, they work, and that means that all our efforts were not in vain. If we speak about the practical side of work that our team did in 2020, I would probably start by mentioning the priorities that we had selected for this year. A very important direction of work for us was the collection of data about the existing mechanisms of funding on the national and local levels. We wanted to see what barriers and problems existed. And based on those data, we built the budget advocacy campaigns. Some of the recommendations that were made thanks to this analysis will be used for planning the campaigns for 2020 as well. The second important direction we focused on was providing technical assistance for statutory regulation of the funding mechanisms, and of course mentoring, technical support in the process of implementation of the budget advocacy campaigns on both national and local levels. I will further tell you about the processes themselves that took place and about the results that we received. I will probably also briefly mention the approach that we used, because I've mentioned 3 priorities, but we also must understand that the budget advocacy for us is a continuous cycle consisting of 5 key components. Beside the analysis of the situation and assessment of all the processes, it is important to shape the priorities of the authorities, take part in the budget development process, and in the processes of policy making about how the money is going to be spent, who will be the recipients and how they're going to use them. And the mechanism for money distribution is also important. And when we speak about building up the capacity of NGOs on budget advocacy, that's a sort of general line for the whole project. And this year, we've invested a lot of efforts to strengthen the capacity of the organizations for all the 5 components. And those webinars that Serhiy has mentioned before, they were focused on all these topics. We spoke about what mechanisms worked in the countries, how the civil society could join those attempts, how they can use the resources, how to effectively shape the priorities of the authorities on the local and national levels, how to effectively build campaigns based on the analysis. Because when we speak about the budget advocacy campaign, we must always speak about figures, problems, but specific things. We have overgrown that stage when we were just shouting out loud that we need money. We need to clearly understand how we are going to spend the money, how much do we need, and we need to clearly track and support the whole process. Despite the fact that we had to reshape our approach to implementation of the initiatives and switch to the online mode, everything that we had planned for 2020 has been implemented. Moreover, thanks to savings of the resources, the money, the time, we were able to improve certain components. We've been able to conduct many more training sessions that we had planned, cover a broader audience, and we were able to expand the geographic aspect of our studies and better review the funding mechanisms implemented in the countries. And the situation itself, this transition to the online mode, made it even more relevant to create digital solutions for our field, for our area, with the support of the Open Society Foundation and the SOS project. We started the portal Open Transition Online. This is now being tested and it is being filled in with information. And the idea behind it is that on that portal, in addition to the profile of the country with the epidemiological situation and with information about the amount of funding, we will be tracking the progress in those countries. And thanks to the methodology that had been developed by the European Harm Reduction Association, we will be able to see differently the processes for ensuring sustainability and the transition process in the countries. I think this portal will be fully functional by the early months of 2021, and currently it's already available, it's accessible on the web, and still information is not complete, so we're looking forward to receiving the results of the study conducted by the Eurasian Harm Reduction Network, and after those are published, the portal will be fully functional. As I have already said, the main line of work for this and for the previous year in terms of budget advocacy was statutory regulation and provision of technical assistance on statutory regulation of TB/HIV funding processes to the countries. Without this component, it would be difficult to speak about sustainability, as our task is to move donor-funded service programs into the public systems. Without the statutory regulation, it will simply be impossible. And that is why this process was initiated in every country, and this year we already see some progress. Some countries have draft standards or tariffs. Some have already adopted such standards. And I think that by the end of 2021, by the end of the project, this process will have been finished in each country, and we will achieve proper legal framework for all services for HIV and tuberculosis. If we speak about the effect of the project and activity of this budget advocacy, first of all, we need to consider the actually provided funding by the state, the progress in funding provision, and by the end of February, I think we will have the final numbers for 2020 and some declarations for 2021, and this is going to be an important indicator for evaluation of efficiency. But another important indicator is about the change in quality of work of non-government organizations and whether we have been able to improve, to build up their capacity for budget advocacy. And I remember the first budget advocacy school in 2019 when we spoke about the budget cycle, budget processes, levels of budget, how the central budgets interact with local budgets, how do you influence those processes, how to take part in legal framework shaping, how to do policy making, and what is the role of civil society in all of this. I remember very well those discussions and people rejecting those topics because many organizations said we are an HIV service organization, we know how to provide service, we know the needs of the clients, and budget and statutory regulation is not our cup of tea. But in these 2 years we have been able to achieve good progress in quality assured work in the area of budget advocacy, and the topics that were purely theoretical at the time have become routine because this is the agenda they have to work with now. And of course, it's not just achievement of our organization or our project. A lot of donors, a lot of organizations take part in this. Nevertheless, the project has allowed getting together such an effective team and partners in different countries, the organizations who are now involved in implementation of this project. This is a very strong team who now shows really good progress in budget advocacy. You just can see it. You see the changes every few months because the problems we face on the way, they are numerous and they arise out of nothing. They just unexpected. And for example, VAT, when we were speaking about funding, we had never thought that we would be able, that we would need to think about changing the tax laws, how to make our service tax exempt. But now this is the actual task we all work on. And the issues of funding through insurance companies, through the national health services, these are the things we have to work with now, and this is a totally different level compared to what we had a year ago. For example, that's a huge achievement of the project, and the capacity of the team that we got together for this project can be used to resolve very important global issues. And they have already been forced to sort of get involved with this, because if we do not influence the healthcare system, we cannot ensure sustainability of services. So we are doing our best in this area, and this is what we will have to work with. Of course, it's also important to evaluate the effect of our project in terms of how we work with the priorities, because we've invested a lot into shaping the priorities of local authorities, national authorities. And the situation with the COVID showed that those investments were needed because the services have not suffered really bad. No funding was cut, and the process is going on. And talking about the improvement of the legal framework, we still see it as the indicator of our effectiveness, what we're going to be able to achieve during the project, what legal documents we are going to sort of promote, advance, and get approved. And that's going to be a very important indicator of our effectiveness. And I've already said that in every country, those processes have been initiated. And I think that by the mid-2021, we will have substantial results, and those documents will be approved at the government level. I would like also to briefly speak about the conclusions that we've made and speak about the priorities that we see for our further operations. I will repeat again, statutory regulation should become the priority. We need to make our best to ensure that by the end of the project, every country has a package of legal documents regulating the mechanisms of how the services are provided, at what cost. We are speaking about standards, procedures, tariffs. This is a realistic task, actually, and I think that if we all do our best, then by the end of the project, those things will be achieved. Talking about digital solutions, that's something like forced, but on the other hand, we need to understand that technology is progressing and we must not lag behind. And to ensure effective work on collecting the needs or analyzing the gaps, sharing the knowledge and experience, we need to look for digital solutions. That is why development of such tools as the transition portal or the product that we are developing now together with the Global Fund, that's the portal for evaluation of social contracting progress. Those are priorities that have really big importance, and we encourage everyone to join in development of such tools. And I think that by adding some tech in our operations, we will improve our efficiency. This situation with the pandemic will remain with us in 2021, and while it didn't hit us really bad in 2020, there is no guarantee that it will remain the same in 2021, or that there will be no attempts to cut funding. That is why shaping the priorities of local and national authorities must remain the priority. We need to focus on this work because there are high risks that if the economic situation does not improve really fast, if the epidemiologic situation remains the same, our programs will start to suffer, and it will be difficult to speak about increasing funding. We will have to fight for having the same funding as the year before. And one of the important conclusions is that advocating for funding of HIV and tuberculosis programs, we cannot avoid talking about general healthcare systems and funding them, because when we speak only about HIV and tuberculosis, we need to understand that we compete within the public health system with other diseases. And the problem is that our healthcare system works in the situation of deficit. It lacks funding every year. So the vector of our advocacy should change somewhat. We need to advocate for general improvement of funding of health, and then it will be easier to get more funding for HIV and tuberculosis programs. And we need also to keep track of how the healthcare systems get transformed. And in many countries, this process has started or has already been completing of transforming healthcare systems. They have now the medical insurance systems, national health services as the operators of fund, and we need to move together. We need to align our efforts. For example, in Ukraine, a mistake was made actually, because we simultaneously promoted the funding model and the National Health Service was being created. The tools of the NHS are better actually than the mechanism used by the public health center who procure services, because they can ensure better quality, seamless processes. We do not need to hold tenders every year and select suppliers based on price. Also, a good precedent with Moldova. The system of healthcare was transformed. They got a new model of funding, and integrating our services into it was the right thing to do. And we need to advance the same approach in other countries where they have the same processes. And the same goes for primary healthcare reform. If this process has started in a country, and we see that in a few countries of our projects, we need to keep track of that and align with it and think about what we can integrate into primary care level, like in terms of HIV and tuberculosis services. And here we get a very important priority I've already mentioned, that's the mechanisms of funding. It is important to focus on selecting the right models of funding to improve them based on the principles we fight for. This continuity, accountability, quality of services, and some assurance. We need to advocate for not having to persuade the state and local authorities, national authorities every year to give us money. Our services must be funded just like, for example, primary care services are being funded, and that's a good example of what approaches should be used. I think this alignment with the general public health systems will allow us to make it better and with better quality. And we need also to develop a system for assessing the quality of the services that are provided, because the main goal is not actually providing the money. They can give you the money, but the question is how we spend it. We need to ensure that our clients receive quality assured services and that we achieve real impact on the epidemic. And if we are able to show that we do provide quality, we will be able to then influence further changes. So that's all I wanted to say, all the basic things, because as I've said, budget advocacy is a continuous cycle and it cannot get completed in just one fiscal year or calendar year, because every time we will face new challenges. We will have to evaluate how our activities have worked, what results that they've brought, and we will be setting new goals. And it's a great pleasure to see that in our project we got a very effective, strong team of organizations from all the countries, and the agenda that we have is not difficult to implement, but I am sure that if we keep on doing the same good job like we did this year, despite all problems, it will work out really fine. Thank you. And now we are going to shift to another block of our project and our program. We are going to speak about the rights of key populations. Services for the key populations in the ICA region will not be sustainable so long as we have legal barriers to accessing the services and while the rights of key populations are violated. Unfortunately, in our region, the risk of HIV transmission is criminalized, just like drug use is criminalized or administrative penalties for sex work exist. So the project needs to reach different levels in order to revise the legislation, revise the practices of application of the law, and we need to change the attitude of service providers to key populations and attitude of general population as well. And what specifically the project did in this area this year is the topic of the next session. First, I'd like to give the floor to Yelena Kucheruk for her to tell us about what work is being done by the Global Commission on Drug Policy in response to the situation with drug policy in the ICA region. Maybe there are some progresses in terms of establishing of a regional commission to positively influence the drug policy in our region. Yelena, please, I'm giving the floor to you. Thank you very much, Tatiana. Thanks to the Alliance for Public Health for this conference and for the work that the Alliance has been done in supporting in the region. Dear participants, I'd like to speak briefly but provide a lot of information. I think a lot of you are aware that there is the Global Commission on Drug Policy that unites high-level politicians, people from business, from science, from academia, and the main goal of that global commission is advocating for best policies and best practices regarding drugs all around the world. And when high-ranking, influential people get together, including those who can influence public opinion in the whole region or in individual countries, it does work. And there are examples when, with the participation of the Global Commission, significant changes were introduced into drug policies. Of course, every region is special, they have their own specifics, their needs, and it's obvious that in addition to a global commission, it would be good to have also regional commissions focusing on certain needs and goals. And there are two other regional commissions, Eastern African and Latin American Commission, and it is thanks to the Alliance for Public Health and with the initiative of the Alliance that we initiated the creation of a regional commission for the ICA region. Thus, since the beginning of this year, many partners have made a lot of efforts to start actual forming of this commission. You understand this is not an easy process, and it is the case when the COVID pandemic has probably affected the swiftness and possibilities for getting the commission together, but we do have some progress, and I'm happy to share the information with you, and I really hope that the commission will continue evolving. So personally, we have their president Alexander Kwasniewski, who is also a member of the Global Commission. He was the initiator and leader for creation of the regional commission in the Eastern Europe and Central Asia, and so he's the head of this commission, regional commission. Together with him on the commission, we have Michel Kazachkin, a person who doesn't need introduction. He knows really well about our region. He knows about the situation with the HIV/AIDS landscape and drug policies in the region. And what is important, he knows really well how restrictive and repressive drug policy deteriorates the situation with HIV and AIDS in the region. And like Tatiana said, it is not enough to have good services. We need to work in the area of human rights, and the policies on drug users, they actually define the situation a lot. And in addition to Alexander Kwasniewski and Michel Kazachkin, on the commission we have Yelena Pinchuk, who is the founder of AIDS Fund in Ukraine, and we also believe that this is a very important participant of this commission, a very important member, because they used to work less on drug policy, more on AIDS, but these issues are tightly interrelated, so we really have high hopes for her influence and advocating for better drug policy, not just in Ukraine, but throughout the region. Other members of the commission are two European commissioners, the EU commissioners from Baltic countries, Vytenis Andriukaitis from Lithuania and Andris Piebalgs from Latvia. They are the people who have the experience of policy making at the level of the European Union, and they are the people who know the region, who we also hope will help us promoting better practices in terms of drug policy shaping based on recommendations and standards of the European Union. We also expect other people joining the commission. That's Rosa Otunbayeva, former president of Kyrgyzstan, and Georgy Margvelashvili, former Georgian president, but we are still having negotiations with them, but we do have some expectations. We expect that the commission will consist of 12 to 15 commissioners, and we try to ensure gender representation and regional representation, and they of course need to be high-ranking politicians, people representing business and academia and maybe art as well, so that we could address different target audiences and social groups, thus influencing the attitude towards drugs, drug users, and drug policy. Currently, the work that is being done is not so visible because this is just a preparation stage. When the commissioners get together, and the first working meeting, internal, non-public meeting, not a kickoff. Yeah, it will be an internal working meeting. It is going to happen in March or April next year, and unfortunately, this is the area that was affected by the COVID pandemic, because usually such meetings are offline meetings. And Commissioner Kwasniewski really would like to have this as an offline meeting. Currently, they are producing policy briefs on different issues for the region, for the commissioners to be better informed about those issues. So, thanks a lot to the Alliance for Public Health for this important work in the region, and I truly believe that creating such a commission will let us promote the issues on the general regional level and in particular countries, because high-level advocacy with the participation of such important people is also a relevant and needed process, something that will help us to get the ball rolling, so to say. Why is it so important for the region? Because our region is so different, so heterogeneous in different policies, and certain countries they apply their geopolitical influence, and we know that those countries are restrictive toward drugs, and we know how they influence other countries, their neighbor countries. So we hope that this regional work will help us mitigate these issues and achieve a common understanding on various issues. I'm happy to answer questions, and this is all I wanted to say for today, actually. So thanks a lot to the Alliance once again. Thank you very much, Yelena. You can ask her questions in the chat or at the end of our meeting. We truly appreciate this progress that you were able to achieve in creating a regional commission. This thing has had to be done long ago. In 2020, the REACT system has been launched to register and act in response to violations of human rights of people living with HIV. And Sergei Filipovich will tell us about what has been achieved in the 8 months of the work of the system in the region. Please see the slides. Dear colleagues, the topic of human rights in the context of access to services is probably the main one, and we consider it now. So the REACT program in 2020 during the pandemic has been expanded even more. Now it's implemented in 4 countries, and almost 50 NGOs are involved in the work. They register the cases of human rights violations and help people against whose rights have been violated. We also have now more cities almost 30 settlements of different sizes. And in addition to these 4 countries we have started our project with, we plan to cover Uzbekistan and the Russian Federation next year. We are doing the preparatory work. We are conducting trainings now. Here you see the number of incidents that were registered in different countries, as well as the number of clients who came for our help. In most cases, those cases were qualified as human rights violations. I'd like to emphasize that the country in which we have many registered clients, well, it doesn't really mean that they have bigger problems. It just says that they have active organizations who work through reactors, paralegals, to document those cases. So these figures, as we see, they speak more about the activity of the processes of implementation of the REACT approach, rather than the scope of the problems. So you should not consider that the situation with human rights is worse or better in a particular country. Next slide, please. The REACT in 4 countries is implemented by our partner organizations, and you see them listed on the slide. And together with other partner NGOs in Georgia, in particular, that's Georgian Harm Reduction Network, in Kyrgyzstan, and that's Soros Fund. In Kyrgyzstan, they support the street paralegals, and we've seen some high numbers for Kyrgyzstan, but that has been caused by very active collecting of data about the cases. So that's a representation of the activity. Now, if we check the key populations that are included here, then to some extent or the other, that's representatives of all the key populations, people living with HIV, sex workers, MSM, transgenders. But again, we see some disproportion in sectors, which can be caused by the organizations who directors represented, who reached the key populations. So some organizations were focusing on people living with HIV, others on people who use drugs or MSM. Nevertheless, all the groups are represented in the base and in the project, and we conduct the analysis of human rights violations. If we look at who the main perpetrators are, and you see this is somewhat that one could expect, but on the other hand, it makes us sad and thinking hard. Well, first of all, that's law enforcement authorities. That's not a surprise, and they very often take very restrictive position with regard to our key populations. But the same goes for the healthcare institutions in the 4 countries. They've also shown similar attitude. Health professionals, they misbehave when we speak about the key populations. They stigmatize the key populations. They discriminate them. They deny them the main rights to access health services. And also, closest partners play their part, the family members or sexual partners, if those are people from some group. So these are top 3 of perpetrators, the closest circle with which we have to work, and with which we will work further. Now, talking about the plans for 2021 and the implementation of REACT, we don't just record the cases, we also provide feedback and response to those violations. On the individual level, we provide help to the clients to resolve the problems of violations of their rights. And here we would like to stress that there is quite a high percentage, and that is a barrier in providing care. A high percentage of clients whose rights are violated, they don't want to somehow go further and defend their rights. They are afraid of further infringement and further violations of the rights, so it's a big barrier on an individual level. So you see, that is the part of people who did not want to go further to defend their rights. Now, a different level of response to violations is the local level. So when violations are systemic, and they don't just involve one client, they're not individual. Here we have the example of Moldova, where they had systemic violations of pregnant women at maternity houses because they were somewhat stigmatized and prosecuted by health professionals. So there was a response. There was an order to prohibit discrimination and awareness raising work with the health center. And there was also a problem with Argiev. They had problems with access to OST because it was too remote. Now some work has been done. And the national level of response to violations, when we speak about advocacy at the national level, the advocacy for amending the legislation. And here again, we have a good example of Moldova, who have started the negotiations with the Ministry of Health to change the existing legislation prohibiting adoption or taking care of children for people who live with HIV, or the facts of discrimination of people who live with HIV in the area of employment. And there was a case when a client represented client's case was represented by his lawyers. We now have the information that the issue with adoption has been resolved, and that's a great example for the rest of us. So that's how the national level advocacy works at the moment. So thank you very much for the update. Now, there are 3 levels of violations. We don't just record the cases. It's important that we respond to them at 3 levels. You can get more detailed information if you use the link. We've prepared analytical reports for the countries. It's quite detailed. And also in December, we had a very good and thorough meeting on React to share the experience. Thank you. Thanks a lot, Sergey. And the 100% Life network, together with the regional networks for harm reduction and key populations networks, they've worked to fight stigma, discrimination, and other barriers to access services for key populations. And now I'd like to give the floor to Evgenia Kononchuk from 100% Life to tell us about what they did in 2020. Dear colleagues, my name is Tatiana. Thank you very much. I'd like to continue about the things that Sergey spoke about before me and other colleagues too. When we speak about sustainability, we say that it includes the various components. And we say that sustainability is not just stability of work of the mechanisms for provision of services and providing resources. It's not just optimized and affordable drugs. It's also no stigmatization, no discrimination or other barriers that prevent our key populations of people living with HIV from receiving the medications they need, the health services they need. That is why the component that we do, the second component now, the reduction of all sorts of discrimination and stigmatization, is one of the components of sustainability. And when we want to speak about the key achievements of 2020, I'd like to emphasize the regional level. And if we speak about that, we see here the actual results of the countrywide projects. And one of the key things we did was gradual support of the countries and expanding the list of the countries who join the Global Initiative for Elimination of Stigma Discrimination. This initiative is supported now by the Global Fund and the Global Network of People Living with HIV and a number of other global networks. In particular, in addition to the technical assistance to the country partners of this project and the local representatives of the people living with HIV, we conducted a number of educational webinars that enabled us to see what the global initiative includes and how it will help them do their actions in the countries, how it will change the approaches to approaches of implementing partners of some of the projects. And the next activity I'd like to talk about is looking for the most successful practices that have been established in the region and using them in other countries as well. So one of the topics that we see here, can I see the previous slide? One of the successful practices is a great work of organizations in Belarus and some other countries that we now aggregate, and next year we will provide a practical guide for paralegals, in particular for Tajikistan and Uzbekistan, who now encounter harsher discrimination and stigmatizations by law enforcement authorities. Some other initiatives we have some relations to and with which we work are the initiative at the level of Kazakhstan, and that's advocacy for amendments to their legislation in terms of decriminalization of HIV exposure. And another initiative is in Moldova. We try to continue the efforts that have been launched by a number of key national actors to decriminalize risk infection, HIV infection.
The next activity is one of the key for us in this module. This is the stigma index of people living with HIV. Why is it one of the keys? This study is the evidence for any further advocacy and all other activities implemented at country levels. This is a fantastic practice, and we are really grateful to the partners for managing to launch this study in these countries. I personally think that it's quite a success being able to launch the study in these countries which are not so easy to implement, and unfortunately COVID impacted this. We will complete the study only in the first half of the next year, and once completed, then we will promote the results, and we hope that this initiative would later help to all the projects, including the other Global Fund projects. We will continue our efforts next year. We'll continue with the training interventions aimed at scaling up the participation in the global initiative to fight stigma and discrimination. We'll continue efforts on advocacy for the amendments to the discriminatory norms of legislation in the field of HIV. We'll work with the media, to increase quality content on HIV issues, and will provide legal support in 3 countries. And this is it, essentially. Thank you, Evgenia. We have Anna Dobbach from the Eurasian Association of Harm Reduction. She will tell more about the efforts throughout this year and about their vision on what should be done by project partners. 2020 has been quite an intensive year for the Eurasian Harm Reduction Association. We've been dealing with the sustainability of services, the OST sustainability, because there were programmatic issues and there was lack of coverage and lack of funding. Through the technical assistance from UNAIDS, the partners of the UNFPA and the Soros Foundation, we managed to conduct the assessment in Tajikistan, Ukraine and Belarus. On sustainability, the methodology has been created, the methodology on ensuring the transition plan and sustainability plan for the next year. It will be conducted in the 10 countries of the region. Human rights. First of all, we managed to train the specialists on harm reduction from the NGOs which work with the key populations. We taught them to document human rights violations and submitting this application. It was an online training for 20 specialists, but all the materials are there available for the regional specialists. There were also submissions to the UN committees. One was very strong for Ukraine, when the Committee on Social, Economic and Cultural Rights has issued a recommendation to Ukraine to decriminalize the storage of narcotic substances for personal use. So we hope there would be the active advocacy campaign to implement this recommendation next year. There were strong submissions to 2 UN committees for Russia Federation and on Kyrgyzstan to anti-torture committee. Unfortunately, in 2020, due to the pandemic, some UN committees are not really effective, and this, of course, is the decrease in the possibilities, and we respond to this. Also, jointly with the European Network of Harm Reduction, we have issued a position statement on expanding the package. We advocated all special rapporteurs of the United Nations to stand for the rights of people who use drugs during the pandemics. And as a response to the key difficulties for people, especially for women who use drugs, especially in the situation of family violence and violence by the police, we've started working on the system of legal, social and psychiatric support for women who use drugs in the situation of domestic violence. We call it Project Shelter. To be continued. Thank you, Anna. This is quite an impressive work to counter the rights violations for key populations. The work at the international level. I would like to invite representatives of several regional networks of key populations to share what they have done as part of the project. Now we have Yuri Yorsky from the Eurasian Coalition on Health Rights, Gender and Sexual Diversity. Yuri, the floor is yours. Hello. Thank you for the introduction and thank you for inviting me to this meeting. This year, ECOM, as part of its effort, continued applying efforts on the strategic intervention to create favorable environment in the region where the gays and other MSM and trans people would have equal access to HIV services. Unfortunately, as our partners have mentioned, our really long-standing partners, the European Harm Reduction Network, our group has also seen the high level of stigma and discrimination in the region. That includes the healthcare and other public authorities. The key issue, we think, is the lack of anti-discrimination legislation that would really ban the discrimination on sexual orientation, gender identity. We need to reiterate again and again that there are countries where homosexuality is still criminalized, like Uzbekistan. There it still is criminalized. The gays would get 3 years of prison if they are prosecuted. We have managed to document 52 cases with our staff in 8 cities of the project. And these 52 cases were mostly the violations from the side of the police officers who use homosexuality to blackmail or to extort funds from the representatives of the gay community in the EECA region. We have used this data for international advocacy. We want to use them in the negotiations with the cities, with the municipalities. This year, just like the colleagues, we have also used international agreements and authorities in order to achieve the pressure from the international community and to draw the attention to the issues which gays and transgender people face in this region. We had successes. In Moldova, the Committee on liquidation of all forms of discrimination towards women. They have also presented a report on trans women. They presented it in Geneva, and the committee also issued recommendations for Moldova, stating that trans women should be actively included in the national programs on HIV in Moldova. Also, this year we've provided reports to the Human Rights Committee on Russia and Kyrgyzstan. On Kyrgyzstan, a report has been provided. We also prepare a bunch of other reports, in particular on countering discrimination of women. Also, we submitted the report, but as Anna said, due to COVID, there were no travels to Geneva, and it was more difficult to really substantiate the report and to present them, but we managed to submit them anyway. We continue working on the report on Russia. There we work in Novosibirsk, Kaliningrad and St. Petersburg, the 3 cities of the project. We've conducted successful trainings on improving the awareness, on protecting the rights and the possibilities of advocacy, so that the knowledge would be also broadcasted or, let's say, scaled up next year. Also, digital security is still an issue for the key populations in the region. Thank you, dear colleagues. I'm looking forward to see you next year. Thank you, Yuri. The matters of gender and provision of service for transgender people. Well, the Eurasian Network of Health for Key Populations, they've also have been dealing with this, and I would like to invite Pavel Aksionov to speak on this subject. Thank you, Tatiana. We really have no time, so we'll try to be brief. It is important indeed that the project helps us working with different people. This is a unique group indeed. They really endure the risks of stigma and discrimination, and they have their specific needs on access to treatment, which should really be aligned with their other needs. For example, the needs of gender transfer and hormonal therapy. There were very specific interventions related to gender identity. So the protection of rights for transgender people should be considered appropriately. So despite all these needs, still transgender people are not part of a separate group in terms of epidemiology and in terms of the activity on mobilization of the group. That is why, as part of our project of the network, which is called the Sustainability of HIV Services for Transgender People, well, the main task is the creation of the well-coordinated, well-formed transgender community in the region. And unfortunately, so far it has not been well organized. A lot of effort is required. As part of the project, we had two main events: the continuation of the Eurasian Gender Academy. This is our unique innovation, and also the capacity building initiative to train the specialists on understanding the needs of transgender people. Also, we have the small grants program. So briefly on the result. This year, we have managed to conduct 6 online sessions. As part of the Eurasian Gender Academy, we had planned one big in-person meeting, but due to the restrictions which were there in the countries, we have asked, and the 100% Life has approved it quite fastly to change the format. So we have covered 5 countries: the Belarus, the Georgia, and Kazakhstan, Russia, and Tajikistan, and we have included both the representatives of key population, the lawyers, the representatives of authorities, and so on. And the topics covered were gender theory, the integration of gender analysis into the assessment, monitoring and evaluation of national policies in public health, and how is gender included into the is integrated in the national context, the gender budgeting, inclusion of gender indicators into HIV programs, and awareness raising considering gender factors, because not many people still were aware of all the factors. That is why the Gender Academy has been very relevant. And as part of this small grants program, this probably is the main program we've had. It was aimed at local communities. It's 100% direct impact into the local communities in these countries. We've supported 7 projects and 1 individual project. You see the countries: Tajikistan, Georgia, Russia, Montenegro, Kazakhstan, North Macedonia, Russia, and it was up to $4,000 in grants. They have let us conduct important interventions. Well, unfortunately, the slide is in English only. We didn't have time to translate it. So, we have organized trainings for 156 members of the community. So 9 trainings, 24 advocacy activities, including meetings with health officials and practitioners. 1 advocacy video from North Macedonia that was really explaining the demands of trans people. 4 new information materials were developed. We've provided direct peer services for trans people, 13 peer self-support sessions, 50 legal counseling sessions. We've dispensed self-safety kits on COVID and condoms, and conducted direct service. We have conducted 1 gender assessment study with the new partner in Tajikistan, and we had other results. But the most important probably was, and we managed to achieve it despite the political barriers, we managed to create another new transgender association in the region. It is the new association in Belarus that is protecting the rights of transgender people. They had a very successful first initial assembly. Now they are being in the registration process. So thanks again to the SOS project for the possibility to work with this really important group, which so far has not been in the spotlight, so to say. Thank you. Thank you, Pavel. Thank you for prioritizing the needs of this group. Indeed, the response to the needs of this group is still lagging behind. Well, we mostly focus our response on HIV, but we coordinate our work also with the TB organizations. We are in active cooperation with TB people, and Medea Khmelidze will present what was done together
Hello,
this year.
everyone. I'm Medea, representing Network TB People, and I'm really glad to be part of today's meeting and tell you some of the updates and some of the progress that we made regarding SOS project in the target countries of ours. That is Russia, Georgia, Kyrgyzstan, and Kazakhstan. So first of all, let me give you some brief updates regarding the impact of COVID-19 epidemic to the implemented activities we've covered. Of course, it really had threatened some of the progress in the worldwide, and Eastern Europe and Central Asia region is not an exception. But because of the COVID-19 restrictions, we had to postpone some of the biggest regional advocacy meetings and workshops. But actually, we canceled them in offline meetings, but transferred all the process in online meetings. And that was pretty much caused to the challenges because there was something new emerging, and we need to somehow deal with the new realities and adjust our everyday work to those emerging realities. This was one big challenge that we had in the beginning of the year in related to COVID-19 context. But still, somehow with the support of our partners, with the technical support of 100% Live, we managed to push forward some of the important activities, and namely the information, education, and communication part, in which we've developed the materials with not only this time grasp the management of the HIV and TB, but also COVID-19. By this, we are still trying to have two basic outcomes. First of all, raise awareness and on co-management of these three diseases. At the same time, we're trying to contribute to increasing the flow of the key affected populations to the comprehensive diagnostics in all three directions. We all understand that because of the COVID-19, again, this diagnostics pretty much suffered if we compare the percentage of the previous year to the year to 2020. Another big direction that we still made some of the progress was related to the evidence generation regarding the catastrophic health expenditure in relation to TB, mostly affected to people living with HIV. So this is the direction actually having also being very acute in terms of COVID-19 context, because you understand how this monetary burden really affected healthcare systems in each and every country. I would like to say that the pilot research protocol is already developed with, again, the support of the national expert, with support of the WHO experts, and what we're planning to do is to end up the field work and having the final outcomes by the end of June, and in parallel replicate this innovative research methodology in Kyrgyzstan and Kazakhstan. Also, another direction I would like to mention that was done in collaboration with TB Rep 2.0 project. That's also building the innovative learning platform under which SOS project supported full development of HIV and TB module, which is already done, and also with the huge support of 100% technical expertise. So these materials are already available and will be pushed into use pretty soon. I would like also mention some of the best practices that have been fixed on the municipal level in terms of contributing to widening access to social support services for the TB patient, including those living with HIV. And would definitely say that in these hard times, whenever COVID-19 pandemic affects that much and threatens all the fixed outcomes that we had in HIV and TB directions, it was really hard to make the steps, and it won't be possible without such a big support of our partners, with the big support of the project team, also our volunteers, our beneficiaries who mobilized themselves and made all the possible contributions to the process. So with that, I would like to thank you, and first of all wish you the health, and let the upcoming year 2021 be more fruitful, so to say. Thanks a lot, and thank you for attention.
Throughout all this meeting, we have discussed the impact of COVID this year. We would like now to tell you about the target response to COVID, which was started this year. The Global Fund has provided the possibility for existing projects, for our project as well, to scale up the services and to provide the COVID response to HIV. Sergei Filipovich will present the details. So, dear colleagues, the last programmatic section, which we didn't have in the beginning, but it emerged in 2020. The response to COVID and all the related issues. Recently, we had a meeting in September, and we see that the situation is deteriorating globally. The number of cases grew 180% globally. Well, in our region it's 247%. In some countries it's even over 300%. So it's not optimistic. What can we do? We have already mentioned that the Global Fund has supported the first regional COVID-19 program as part of the regional SOS project. The activities of this program started on November 1st, 2020, when additional funds were allocated. The focus of the program is both regional and municipal. We still remember the cities, especially we remember the countries where no global funding has been provided. This is how we've had Russian Federation cities and Bosnia and Herzegovina, and we organized activities on HIV service in the context of the pandemics, and also achieving gender equality for the key population in response to the pandemics. Our partner, the subrecipient, is the Association of Harm Reduction. It has already been mentioned that they now plan to issue subgrants to protect women suffering from domestic violence, the Shelter Project. Also, we have planned to improve the coverage for the region in the context of the pandemics, to secure service provision in the context of HIV. What was the new thing which was added to the program? We have used the possibility to relocate the funds and to procure fast antigen test for COVID-19 for $450,000. The rapid tests were procured for the participants of the project. Here you see more details on essentially all the initiatives which I have already presented. The rapid tests for 8 countries, ensuring the continuity of services in 3 cities of the Russian Federation, the provision of PPEs in the cities of Bosnia, launching the telemedicine platform in Bosnia and Herzegovina, also human rights protection, the shelters, the mini grants to support women who suffer from domestic violence. Even before we started having this dedicated block on COVID, we had webinars on best practices. We even had this map of communities' initiatives. This is a unique experience of our partners being mapped on an online map. 55 interactive stories from 19 countries were collected, and they are still available if anyone is interested. Here we also have information about additional studies. We really have to assess the COVID influence in full in order to develop the recommendations on successful, on sustainable planning. This, of course, is budget advocacy, as already was mentioned today. We have also launched the study on the impact of COVID-19 on the sustainability of HIV and TB services in 6 countries, and a study on the rate of HIV testing and the involvement of people living with HIV in antiretroviral therapy programs in the region. We continue the webinars on decriminalization of HIV transmission and other human rights issues relevant in the situation of the COVID pandemic. Well, this is the set of those innovations. I'm sure most of you have already been applying them in your countries. From the beginning of the pandemics, we've adapted the programs as much as possible, including the possibilities of online counseling and being able to get services remotely using delivery services, and that also tried the dispensation of OST at home, and other aspects also have shown their flexibility, and we hope that they would be preserved in the future and maybe even expanded. For example, the dispensation of OST drugs, it had been advocated before, but in the situation of the pandemics, the figure managed to grow up to 90%. People get 14 days worth of OST, which already is good. Thank you. Thank you, Sergey. This was the last presentation on the main part of the program. And this would be the end of the Facebook and YouTube stream. I would like to say thanks to the presenters, all the participants, for this very interesting event.